All right, well, there's a ton of advice out there on how to increase your chances of having a baby. But how can you tell the difference between fact and fiction? Well, here to share some common fertility myths is Dr. Paul Wilkes of Desert Perinatal. How are you doing?
I'm good. Thank you for having me back.
Well, listen, this is a big topic right now because lots of people in Hollywood are pregnant and they're not all 25. So I think a lot of people are looking what is true, what is not true. We're hearing a lot of different things out there, starting with age. We see Halle Berry, who's 46. We've seen a lot of moms in their 40s. And Halle Berry said no fertility, she just got pregnant. So is really 45 the new 35?
Absolutely not. I think when you're talking about 45 is the new 35, where that myth got started is women have delayed childbearing for any number of reasons. But really, as a woman ages, her risk for pregnancy complications while pregnant and her risk for chromosomal abnormalities in the baby can go up, and after the age of 40 that happens exponentially.
So it can happen, like you were saying with me, that yes, Halle Berry may have been an anomaly. She got pregnant, probably that can happen still at 46, but that's not likely.
It's unlikely. I mean, the average age of menopause for a woman is 51. As you get closer and closer to that age, the likelihood of spontaneous conception, of spontaneous pregnancy without any assisted reproductive technology goes down.
And don't you think when we see a lot of these celebrities who are having babies, especially twins over the age of 40, that's almost always, fertility help, IVF,
yes.
and yeah.
Yes, I would think that in those instances they've gotten some assistance.
Okay, so age, so it's still the same. I mean, keeping yourself in good shape. People say, oh, Jennifer Aniston looks great at 44. She can have a baby, but your eggs are still 44. It doesn't matter, right?
Right, and that's the important thing. All the eggs you're ever going to have in your life were present in those ovaries at birth. So that lifetime exposure, the longer you've been alive, the more exposures, the higher the risk for something to go wrong.
Okay, second one, we're talking about different positions during lovemaking. And so a lot of people wonder, I'm trying to say this the most PC way I can, is there certain, are there different ways, are your odds going to increase if you get a little more experimental?
Well, not necessarily. So there is this idea out there that if you do lovemaking in different positions, as you said, that you can hedge your bet for pregnancy or for the gender of a child, either a male or a female. And that's really all myths. Really the only one, and there is one out there that I think we're going to discuss about what to do after sex to increase.
So, but missionary isn't the best way to get pregnant? It doesn't really matter which way?
Absolutely not. It doesn't really matter which way. All
right, and then the third one really quickly you're saying is, if you are trying to get pregnant and your husband trying, after you have had sex, is a headstand, is pulling some form of gymnastics into the situation good?
Actually, the advice is to pull a form of gymnastics during sex. And that's going to increase your chances.
I mean, really? I mean, are any of these things that we hear?
A pelvic tilt.
Okay.
So if you think that you want the male swimmers after lovemaking to be able to get to the egg, really gravity can be your friend.
Really?
But too much of a good thing is not a good thing.
So you don't need to do a headstand, just a little tilt.
You don't need to do a headstand, just a pelvic tilt, and sometimes just something as simple as a pillow to lift the pelvis, and that actually has been shown to improve your odds of conception.
Okay, so that one is true. A little pelvic tilt will help.
You don't have to do a headstand, and don't do a cartwheel. That will decrease your risk.
No, don't. Or back handspring's no good either.
Back handspring, horrible idea.
Not good. Okay.
Yes.
Fourth one too. A lot of people think that it's, if they're trying not to get pregnant, that sometimes during their period that's a good time to have sex. But you can get pregnant during your period, correct?
Well, that's kind of a yes and no. So during the actual menstrual cycle, you cannot conceive. But some women will have mid-cycle spotting, and that's actually the time they're ovulating, and they confuse that with a menstrual cycle. So that 3 or 4 or 5 day cycle, not possible, but you have to be absolutely certain that's your cycle and it's not mid-cycle spotting.
Because I know a lot of young kids too think that's true and they're using that as birth control, but that's not.
Yeah, that's a bad idea.
That's a bad idea for sure.
Right.
The last one, truthfully, is when a lot of people think that fertility and infertility issues are all a woman's problem. The woman's parts aren't working correctly. It's her eggs or her age, but the man is just responsible for problems, correct?
Absolutely. So a third of infertility is female factor, a third is male factor, and a third we don't know. We can't figure it out even after an exhaustive workup.
So would you say after like 6 months or a year, if you are, say you're in your mid-30s and you're trying to have a baby with your husband or whoever, and it's not happening, how long should you wait to go get fertility help?
So that time period is shorter the older you are.
Sure.
But my recommendation would be if you're having 6 months of properly timed intercourse, and even using an ovulation predictor kit to say, I know I'm ovulating, we're doing this at the right time, we're making love at the right time, you ought to seek help. So 6 months in the mid-30s.
And if it's, like I said, if it's older, go right away.
Go right away, yes.
And have your husband or your partner test it, because it might not just be, it could be their, the guy's issue. It could be, right?
That is absolutely part of a complete infertility workup. You have to
check both
partners.
Excellent. Good advice so much. Jason, I think he's so enlightened. He had a lot of...
Glad to have a lot of good stuff.
He's been trying to get pregnant for a long time. I think he's been doing it wrong.
However, Bob Eubanks just called and said if we're going to be using a couch and talking about this, we should refer to it as making whoopee.
Making whoopee.
Yes,
right? Making whoopee.
Yes, that's the only thing.
That's right.
All right, guys.
Thanks so much, Doctor. Appreciate it. Thank you.
Absolutely.
So, speaking of that, it's Roy.